This is Professor Wick from RN2 Professors with a review video for you on potassium imbalances. In this video, I will review questions on potassium imbalances. I will show you how to determine what the question is asking you and the rationale for the correct and incorrect answers. This is part of our Fluids, Electrolyte, and ABG series. Let's review. Here's our first question. Hydrochlorothiazide, a diuretic, is prescribed for a client who is retaining fluid. The nurse should encourage the client to ingest nutrients that contain which electrolyte? Number 1, magnesium. Number 2, potassium. Number 3, calcium. Number 4, sodium. This is an application question in the implementation phase of the nursing process. To answer this question, you need to apply your knowledge of how most diuretics affect the renal mechanisms for tubular secretions and reabsorption of electrolytes. Read through the answers and pick the electrolyte that will need to be increased. Number 1, magnesium. Number 2, potassium. Number 3, calcium. Number 4, sodium. The correct answer is number 2. This was a pretty easy one to get you started, but we're going to get a little bit harder after this. A primary healthcare provider prescribes an intravenous infusion containing potassium for a client. Which is the most important nursing intervention before administering this solution to the client? Number 1, assess the skin turgor. Number 2, obtain blood pressure. Number 3, measure the depth of edema. Number 4, determine the presence of urinary output. This is an analysis question in the assessment phase of the nursing process. The nursing intervention is data gathering. Refer to pathology to determine what assessment could show a possible risk for giving the potassium infusion. Read the answers again and pick the one that fits the correct assessment. Number 1, assess the skin turgor. Number 2, obtain blood pressure. Number 3, measure the depth of edema. Number 4, determine the presence of urinary output. The correct answer is number 4. When kidney function is impaired, potassium can accumulate in the body and exceed the therapeutic level of 5 milliequivalents per liter, which can cause cardiac dysrhythmias and arrest. The other answers are incorrect for the following reasons. Assessing skin turgor is unnecessary for the administration of potassium. This is part of the assessment of a client's hydration status, particularly when the client is at risk for dehydration. Although the vital signs should be measured when a client is receiving any fluids or electrolytes, monitoring the heart rate and rhythm is a more significant assessment than the blood pressure concerning the administration of potassium. Both a serum potassium decrease, which is hypokalemia, and an increase, which is hyperkalemia, can cause cardiac dysrhythmias. Measuring the depth of edema is unnecessary for the administration of potassium. This is part of an assessment when a client has excess fluid volume in dependent tissues in which the hydrostatic capillary pressure is high. A nurse is caring for a client in the emergency department. The client's electrocardiogram tracing is indicated below. Which additional response in the client that can be clustered with the results of this ECG tracing should be assessed by the nurse? Select all that apply. Number 1, bradycardia. Number 2, flaccid paralysis. Number 3, increased bowel sounds. Number 4, ventricular dysrhythmias. Number 5, decreased tendon reflexes. This is an analysis question in the assessment phase of the nursing process. This is also a select all that applies question. To answer this question, first, you have to determine what would cause the ECG tracing to look like that. Then you need to pick the additional symptoms you would see on a patient that presented with this ECG. Let's read through the answers again using that knowledge. Number 1, bradycardia. Number 2, flaccid paralysis. Number 3, increased bowel sounds. Number 4, ventricular dysrhythmias. Number 5, decreased deep tendon reflexes. The correct answers are 1, 2, and 3. The electrocardiogram tracings indicate hyperkalemia. That's because of the tall, thin T waves, prolonged PR intervals, ST segment depression, widening QRS, and the loss of the P wave. Bradycardia is associated with hyperkalemia. Potassium, an electrolyte, is part of the sodium-potassium pump that is involved in muscle contractions. The heart is a muscle. Flaccid paralysis, which is muscles that lack tone and strength, are associated with hyperkalemia, again because of potassium's involvement in muscle contraction. Increased bowel sounds are associated with hyperkalemia because of hyperactivity of gastrointestinal smooth muscle. The other answers are incorrect because ventricular dysrhythmias and deep tendon reflexes are associated with hypokalemia, not hyperkalemia. Next question. A client receiving a diuretic is encouraged to increase the intake of potassium. Which food selected by the client indicates the teaching is understood? Select all that apply. This is an application question in the evaluation phase of the nursing process. This is also a select all that applies question. To answer this question, you need to apply your knowledge of nutrition and what foods are high in potassium. We are looking for correct answers from the client that shows that they understood the teaching. Let's read the answers again and pick the correct foods that are high in potassium. Number 1, pears. Number 2, cabbage. Number 3, cantaloupe. Number 4, fresh salmon. Number 5, chicken liver. The answers are 3 and 4. Cantaloupe and salmon are excellent sources of potassium. 1 cup of cantaloupe contains 427 milligrams of potassium, and 3 ounces of salmon contain 305 milligrams of potassium. The other foods listed have 100 milligrams or less in a serving size. Here's our final question. A nurse assesses a client for the clinical manifestations of electrolyte imbalance. Which of the following indicates that the client may have a potassium deficiency? Select all that apply. Number 1, increased blood pressure. Number 2, irregular pulse rhythm. Number 3, muscle tension. Number 4, chest pain. Number 5, dry hair. This is an analysis question in the assessment phase of the nursing process. It is also a select all that applies question. This question is asking you to choose all the related symptoms to hypokalemia. Think about the signs and symptoms that you would see with hypokalemia as you read through the answers again. Number 1, increased blood pressure. Number 2, irregular pulse rhythm. Number 3, muscle tension. Number 4, chest pain. Number 5, dry hair. The correct answer is number 2. Remember that select all that apply questions can have one answer correct, all of them correct, or anything in between. Potassium is essential to the sodium-potassium pump that regulates muscle contraction. The heart is a major muscle. Hypokalemia can precipitate a weak, irregular pulse and ventricular dysrhythmias. So why are the other answers incorrect? Hypertension is associated with hypervolemia, not a potassium deficiency. Potassium is an essential component in muscle contraction. Responses associated with hypokalemia include muscle weakness, fatigue, lethargy, and depressed deep tendon reflexes, not muscle tension. Chest pain is associated with a myocardial infarction or a heart attack and pulmonary embolism, not a potassium deficiency. Dry hair is associated with malnutrition and hypothyroidism, not hypokalemia. That is all for this review. Thank you for joining me today. If you like this video, check out the others in the series and click like, subscribe, and the bell to get notified when new videos are posted.